Start. Good afternoon, everybody. Good to see some friendly faces that I know, and good to see some new faces that I've never seen before. So welcome. My name's Emily Pearson, and I'm the founder and managing director at Our Minds Work. Today's session is in aid of Recovery Month. So September, we have a whole month celebrating recovery. And today we're looking at the topic of women and gambling addiction. So I'm very, very happy to announce that we've collaborated with Bet No More UK, amazing charity providing support for people recovering from gambling addiction. And we will hear a little bit more about what they do later on in the session. So I will be joined today by Christine Delaney, and she's going to share her lived experience, and Rachel Sim, who is one of the training consultants there, who's going to give us a bit of a deeper dive into understanding, the topic of what we're talking about today and what the impact is on a workplace. So let's jump in. Okay, I've got a little poll, which I will share 4 questions just to get a little bit of an idea of who's in the room and what you're looking at after getting out of the session today. Then I'll be having a chat with Rachel around what is gambling addiction, understanding what the problem is. We'll be looking at some statistics and the impact on a workplace as well. We will then be over to Christine, and I'm going to have a lovely little chat with Christine, just exploring a little bit about her lived experience of gambling addiction and recovery, and how it impacted her as an employee in the workplace as well, but also from an employer perspective, what was potentially missed in terms of providing recovery support for Christine. We are going to cover what do we mean by a recovery-friendly workplace? What are the benefits and what does it actually look like? So for those of you who don't know me, I'm the founder and managing director at Our Minds Work, and Our Minds Work literally exists to create mentally healthy workplaces. And we do that by providing HR and wellbeing leads with training and consultancy to help them to develop and deliver mental health and wellbeing strategies. And if you're here from a workplace perspective, as you'll know, everybody has usually a mental health strategy, or at least doing something around mental health in the workplace. We have been doing physical health for a very long time. We're also looking at financial well-being and social well-being as well. But when you actually take a deeper dive into your human distress, human stress, human suffering, and human trauma, often a symptom of that is addiction. And with 70% of people who are struggling with an addiction actually in employment, it's essential that we start to think about how to create recovery-friendly workplaces as part of our wellbeing strategy to support our colleagues who may be living with an addiction and looking for recovery support. So we'll talk a little bit about that. Pop your questions in the chat box as we go throughout this session, and near the end, we'll go through any questions and get the team to answer them today as well. And finally, before anyone leaves, we will talk a little bit about what support is available and how to access it. Okay, so here we go with the poll. Technology, don't fail me now. Here it is. We have 4 questions on the poll. It should have just jumped up. So what is your role today? So please do let us know. Are you here as HR, wellbeing lead, and manager? Are you a health advocate in the workplace, or something else? Do you have a wellbeing policy that includes supporting colleagues living with addictions? And this could be drug and alcohol addictions. It could be behavioural addictions like gambling. We've got yes, no, don't know. We've got the question number 3. Do you feel your workplace is recovery friendly? No, maybe yes. Question number 4, would you like to know more about, what would you like to know more about on this topic? So how would you like to know more about embedding recovery into strategic well-being, how to support somebody living with an addiction? Would you like to understand more about addiction recovery, know more about employees' legal requirements, or know what help and support is available for people? So just a few more seconds as people are finishing off completing those questions. I'll end the poll and we'll have a little look to see what everybody's interested in today? I'm so pleased that this poll worked. Last time I ran it, it didn't work. So thank you, Zoom poll, for being my friend today. Okay, I'm going to end the poll there as everybody's nearly completed it. I'll just share the results so we can all see. So brilliant. We've got 60% in here who are in HR and wellbeing lead roles, which will be perfect for the audience that were here today. Health advocate, great to see somebody here who's advocating for good mental health and wellbeing in workplaces as well. I'm sure you'll get some great takeaways from today. And 3 people from other, feel free to pop your role in the chat box so we know who you are and what your role is. Do you have wellbeing policy? 70% said yes. A wellbeing policy that includes supporting colleagues living with addictions. That is a surprise for me, actually, because I don't think I've ever come across one that actually had it in the policy. They usually have the drug and alcohol policy, but not around how they support colleagues. So this is great to see. We've got 50-50 on maybe and yes for the question of, do you feel like your workplace is recovery friendly? So if you're thinking maybe you're not quite sure what recovery friendly means, what does a recovery friendly workplace actually look like? You'll take some of that thinking away at the end of the session. And lots of more information. Hopefully we're going to cover a lot of this today. Anything that we don't cover, you can get in touch with us and we can support you to better understand more about gambling addiction and recovery, what Bet No More do. And also, if you are looking about how to embed recovery into strategic wellbeing, I'm here to support you with that as well. So let's get going. Some great results there from the go away. Why won't it go away? From the quiz, from our little poll. I'm just going to reshare my screen and we can get going. So, Rachel, are you there?
Yeah, I'm here.
Get us started off with, what is gambling addiction? What are we actually talking about today?
So one thing that we're not talking about is gambling addiction, because not everyone who is experiencing gambling harms will meet the diagnostic criteria for addiction. And there are many more people experiencing harms because of gambling than meet that diagnostic level, because it was created in the 1980s by an American man, and there's so many criteria you have to meet over an extended period. But harms can be anything and everything and nothing.
Mm-hmm.
It can be health related, financially related, work related. It's so complex and multifaceted. It can creep into all areas of a person's life and then outwards into friends, families, and workplaces.
Yeah. It's really interesting, isn't it? The language and the terminology, Rachel, and how we're trying to move away from certain terms. And you see this, quite often in drug and alcohol. We had this conversation actually just before, didn't we, about how drug and alcohol addiction and recovery, they want different language to what we were discussing here, where problem wasn't even something that you wanted to use in terms of gambling harm. So that's really interesting, of how we're having a deeper understanding around what is gambling harms, who is impacted, and what are the varying severities of what people are experiencing as well. In terms of a workplace, what might people experience if somebody in their team was living with gambling harms?
So it depends who's in the team. Is it the gambler or is it a family member? Because both will experience harms in different ways. The trouble is with gambling harms, you can't see them and you can't smell them in the same way that you can with drug and alcohol.
Mm-hmm.
So the harms might not be visible for a long time, or it may be people taking extended breaks. It may be someone going to the toilet a lot. It may be someone phoning in sick regularly at a certain time period. It may be that their body shape or their appetite or anything around physical appearance has changed because they're no longer taking care of themselves in the same way because of the time that they've lost to gambling.
Yeah.
So it's very complicated, and the harms are not obvious
Yeah.
at all.
Yeah.
Because yeah, we all have those moments where we may be acting slightly differently. It could be our mental health, it could be our well-being, it could just be there's a lot of stress going on at the moment.
Yeah.
And gambling could be a way that someone copes with that.
Yeah. Yeah, it's the iceberg, isn't it? It's the tip of the iceberg that there's a lot going on underneath that. And like you said,
Definitely.
the impacts that will have on their stress levels, their mental health, even mood swings. They may be extremely high if they've just had a win, or extremely low if they've had a big loss. You may be seeing, financial distress. So everything that we talk about in terms of workplace well-being, which is physical, mental, social, and financial, it really does cross across every single well-being pillar that we have in workplaces as well.
But it's also considering your workplace gambling culture.
Right. Tell us a little bit about that.
Well, we've just had the Euros. Did you have a sweepstake in your workplace?
Right.
Do you have trips to bingo?
Okay.
Do you have guess the weight of the baby? You all put a pound in and half of the pot goes to the employer or employees and half of it goes to the mum.
Mm-hmm.
Do you sell raffle tickets and fundraise that way?
Yeah. Yeah.
So it depends on the employer's view about gambling,
Mm-hmm.
but it's also about the employee being able to say no and not being vilified for saying no.
Okay. Yeah. Yeah. So the problem with that, I suppose, and what you're saying there is, these could potentially be triggers for somebody to return to their behaviours if they're already in recovery. So very similar to, conferences and events where you can't get an alcohol-free drink for employees who may be in recovery. So not actually considering that there may be people within your team or your organisation that are actually in recovery, and these behaviors or things that you see as like a fun event could actually be triggering for somebody in recovery.
Definitely. Or people who were even just thinking about recovery as well.
Yeah. Yeah. So temptation, almost temptation, that's put in front of people. Right. Okay. That's super interesting. So I've got some statistics for us to have a little look at as well, Rachel.
Yeah.
I'll get them up on the screen here because there's been a lot of research done, and I know, bet no more, you've been doing some of your own research in terms of understanding the problem, but specifically for women, which is exactly what we're here to talk about today. And in terms of when we look at statistics around addiction, whether it's drugs or alcohol and any other addictions, they tend to be very male dominated. And I know that there's probably lots you can tell us about in terms of women with experience in gambling harms.
Yeah.
And in terms of the stats here. So the first stat, an estimated 22 million people gamble each month in the UK. Now, I'm not a gambler, don't even put the lottery on. It's definitely not my thing. So tell us a little bit about why is gambling so popular?
Because it's seen as socially acceptable.
Okay.
You can't go into a supermarket without having a lottery ticket in front of you or a scratch card.
Mm-hmm.
But this 22 million could just be that one person that puts the lottery on once a week, or
Mm-hmm.
it could
Yeah.
be someone who is gambling every hour of every day.
Yeah. Yeah. So that's quite wide in terms
It
of
is. It
what
doesn't
it means.
quantify it.
Yeah. Okay. So the next one, the numbers of women receiving support for gambling addiction has more than doubled in 5 years. Now, I find this fascinating, and especially with the links into online gambling now. And I
Yeah.
know from working in drug and alcohol services for, oh gosh, a very, very long time, You know, women were actually seen as having protective factors from addiction, because it's very, very difficult to have an addiction when you have caring duties. You've got to pick the kids up from school. But now with you know, it being on your phone, you can sit at home with your children and be engaging in your addictive behaviors. So do you think that is one of the reasons why we've seen such an increase in women struggling with gambling harms?
Yes, and we're talking about it more, a lot more.
Yeah.
Because women always have gambled differently to men.
Okay.
Women tend to play online, but there's no hard and fast rule about this. They tend to play in shorter bursts on the phone or on the laptop. But in the last 5 years, the world has really changed as well. We have gone more online and more towards that electronic age, because for a lot of it, the shops were shut.
Yeah.
But it's more about the awareness raising, because a lot of the support services out there were designed originally for men, and there wasn't those support services out there for women. Women didn't know who to turn to for support. So there has been campaigns to raise the awareness that there is support for women. And the lovely Lisa that is on the call was the face of Talk Ban Stop for a good while. I think she's still on the leaflets to show that women have problems with addiction too.
Yeah.
Go on, Lisa.
Come on in, Lisa.
Hi everyone. Yeah, sorry, I just thought I'd just quickly just say a few things. So I'm Lisa, by the way, Lisa Walker. I'm the lead facilitator for New Beginnings, and just going back to Rachel's sort of point. So I myself have been in recovery for just over 6 years from a gambling addiction. But I actually 16 years ago I ended up homeless. And the words still haunt me to this day when I had to go up to the housing officer and explain that I was addicted to gambling. And the words were, if you've been a drug addict or an alcoholic, we could have helped you. But unfortunately, we don't know what to do with a gambler. And that went on. I gambled for another 10 years because of that. And I think as a woman, the shame and the stigma that I felt having 2 children, one of my children is severely disabled. And I always thought, how could I ever possibly disclose I'm a gambler? Would my children get taken off me? And even my own GP didn't know where to signpost me. So when I went to Gamblers Anonymous, I walked in on the 2nd of April 2018. There was 35 men and one other woman. And GA is, it has saved my life, and I still attend Gamblers Anonymous now. But there was a huge, there's still things missing around women and gambling. There's still this shame and stigma, and like Rachel said, it's so hard to detect when someone's gambling. It's so hard to detect the signs because we're so secretive, and a lot of us do it, in secret. But thank God, I had this sort of dream about setting up New Beginnings. It was always a dream of mine to try to get women into recovery, and be able to speak openly, honestly about their gambling addiction, because with gambling addiction, it's not just the gambling. There's trauma. There could be past trauma. There could be mental health. There's lots of things that play a big part in it. And so New Beginnings was created, and I just think that it's not spoken about enough. And this is why this call today is so important.
On the positive, women do seek treatment a lot quicker than men.
Yes, that is definitely true. I think for me, from my personal experience, I hit rock bottom. And that day I was reaching out. And I reached out to Gamblers Anonymous because I didn't know anyone else to reach out for. Obviously now if someone reaches out to New Beginnings or Gordon Moody or Epic, it's different. There's that intervention, that early brief intervention, where we can have that conversation. And I think going forward, what we need to do is, we need to stop men and women getting to that rock bottom. That's what we need to do. So they recognise, hold on a minute, I am spending a bit more time, with money. I'm gambling a bit more than I should. Perhaps I need to do something about this. And there is some fantastic apps you can download on your phone to stop people the Talk Ban Stop campaign I was involved in. So there is a lot more, and there's a lot more being done. I just think it's important that this is highlighted today. And obviously listening to Christine in a minute, being in the workplace as well, because again, I was working as a carer in a supported living house, and one of my jobs was to take the young adults bingo. Well, obviously I'm walking into a bingo hall and I'm addicted to gambling. So, and nobody knows, my work don't know, I'm addicted to it. So how easy was it for me that day to sit with the young adults and also play bingo? And again, I had to disclose to my boss in the end, who then, took me off of going bingo. But it's again the shame and the stigma of coming forward. So yeah. But anyway, I'll shut up now.
Thanks, Lisa. Thank you for jumping in and sharing a little bit of your story there. We really appreciate it. And thanks for all the hard work that you've put in and setting up the New Beginnings program. So let's get through a couple more of these as time is ticking on. And yes, definitely want to have a really lovely chat with Christine. So Rachel, around 7% of UK adults have been negatively affected by someone else's gambling. So this is one of the things that you were talking about before, wasn't it? Around it's who are the affected others who may be impacted.
And that 7% I don't think goes far enough. Really, it depends on like how many people are in your immediate family, how many people are in your social circle, how many people do you work with on a daily basis, and if you were gambling, how would that affect those people?
And especially, we mentioned this before, and we see this a lot with affected others of people with drug and alcohol problems. The affected other is potentially at work, concerned and worried about, their loved one who, is in the throes of an addiction. So how is that impacting other people in the workplace as well, outside of just that person with gambling harms?
And the affected other has a slightly different journey to the gambler, because when the affected other finds out, that's the start of their journey, whereas the gambler has been living with it and dealing with it for a long time. And probably it's taken a good while to pluck up the courage to even talk about it to their partner, to their family.
It's a very interesting point there as well. So harmful gambling costs the country £1.27 billion every year. Where is the bulk of this cost to the economy coming from?
So a lot of the costs we don't actually know. This is a very, very small estimate. So it could be things like education, employment, housing. It could be criminal justice. But unless we know it's attributed to gambling, we don't really know the true costs.
Right. Yeah, this is the thing with statistics, isn't it? It's only usually scratching the surface sometimes, and we don't really know the true impact of it.
The biggest issue is we don't ask. We don't ask about gambling.
In
the same way that we would ask about drugs and alcohol.
Yeah, absolutely. So the next one, over half of problem gamblers in treatment played online. So we've talked, about that accessibility there of it being online. So, somebody actually in treatment still having access to gambling. Is this a problem that you see often?
Yeah, it is. We've heard quite a few I don't want to say stories, but reports from our lived experience panel, even after attempts on their life, that they have gone online in hospital and played.
Right.
because
Yeah.
it is just so easy. And in the UK, we've got about 1,500 different apps for gambling, and that's without going out of the country. And when we first created the Gambling Act, we couldn't see this future.
Right.
It was very much land-based, and you went, but the growth of online has made it so much easier for everyone.
Yeah. Yeah, that accessibility is really an important part of any, addiction, whether it's, alcohol or a behavioral addiction. The more accessible it is, the wider the problem's going to be. And that's why we see, alcohol kill 4 times, I think it's about 4 times as many people as, illegal substances do. So that accessibility is a huge issue.
But the difference between gambling and drugs and alcohol is your body will give out with drugs and alcohol. As long as you can get the money, you can carry on gambling.
Yeah, yeah, absolutely. So the next one, just 3% of gamblers in the UK get help. Why is that so low? Why are we seeing such a low percentage of people actually accessing support?
Because they don't know it's there.
Okay, so this is a lack of
A
information
lack
and
of,
knowledge.
yeah, and a lot of times people's first port of call is the GP, and the GP
Right.
doesn't know where to send people either.
Yeah.
So it's about raising awareness of how we get people into support.
Mm-hmm.
Because the National Gambling Helpline is available 24 hours a day.
Mm-hmm.
It's not just a phone number now. You can talk to them online, you can talk to them through WhatsApp, you can talk to them on Facebook. So there's many, many ways to get in, but there's a lot of stigma and shame attached to even talking about support.
Yeah.
And you've got to be ready for it like any other change. You have to want to change or be ready to change.
Yeah.
And it can take a few times before people are ready. And what people don't know is that there is so much help and support out there now. There's more than GA.
Yeah.
There's counselling, there's groups, there's all different types.
Mm-hmm.
It's about finding what works for you.
Yeah, and I think that's a big thing in any kind of recovery, isn't it? Is it, everybody's recovery pathway is different, and what recovery might look like to one person isn't going to look like to somebody else. It's extremely unique, and things like NA, AA. I don't know about GA, but like 12-step. A lot of people think that that's the only pathway to recovery, and that puts a lot of people off because of the spiritualness around it and some of the terminology that's used and the language that's used. So yeah, it's about, how do we make sure that everybody is aware of the range of support that's available when they need it.
But
And
once
yeah,
people get into the National Gambling Support Network, it's very easy to be moved around to all the different services.
right.
But people don't know that bit.
Yeah, that's interesting. And the last one there, 20% of people with a gambling problem admitted to gambling more during the pandemic. So we saw in terms of drug and alcohol, the drug and alcohol deaths actually increased by 18% because of COVID. We saw people go from recreational use into full-blown addictions because of COVID and the impact of the pandemic, that disconnection from loved ones, that isolation, high levels of stress and de-stress. And that's what human beings do. We turn to a behavior or a substance that will help us to very quickly and easily get out of our heads and get away from the experiences that we're experiencing. How do you see being able to tackle this? Because 20% increase, that's a pretty high increase. What's going to be the longer term fallout from that?
So I worked on the National Gambling Helpline during COVID, and we actually saw that calls decreased,
Right.
but web chats and other forms of communication increased.
Okay, that's interesting.
Because people were at home and couldn't have those open conversations, but they could quite happily text.
Yeah.
And I think all of us did things to excess during the pandemic because we didn't know what was going to happen. The first lockdown, people were still a bit unsure, but once 2 and 3 happened, we sort of embraced the new normal. And that did involve people gambling to excess or drinking to excess or shopping to excess because we didn't have a coping mechanism. And the way that we usually cope was not available to us in the same way.
Yeah. Yeah.
And we're still living with the consequences of COVID. And I don't fully know yet, in all honesty, how it's going to happen in the future.
Yeah.
And what's going to change and what's going to be the impact. But what those 20% or anybody who is experiencing harms from gambling needs to know is there is support.
Yeah.
There is
Yeah.
so much help out there.
Yeah.
And a lot of it, you don't have to be in abstinence. You can still be gambling and want support to reduce.
Yeah. Yeah, absolutely. So thanks for talking us through all of that, Rachel. I really appreciate it. I really appreciate your insight and your knowledge around that as well. So just to kind of highlight the impact on a workplace is going to be the same impact as we already understand in terms of poor mental health. You know, if we are distracted because of an addiction, whether it's behavioral or drug or alcohol addiction, poor mental health, we're going to have a dip in productivity. We're going to see sickness absence. You know, we're going to see potentially conflict within teams. So in terms of the impact on a workplace, whether it's poor mental health or addictions, it does become a workplace problem because it then becomes a financial impact for a workplace to carry.
Or it could also be crime, or it could also be health and safety issues.
Yeah.
We've had reports of long distance lorry drivers playing casino games on their phone whilst in work.
Yeah. Yeah, absolutely. Health and safety, without a doubt, especially in that, you know, logistics that you've mentioned there. So yeah, some great insights there. Thank you. So this really kind of takes us over to Christine. So I am going to stop sharing my screen as I introduce Christine, and we're going to have a little chat for the next 10 minutes. So hello, Christine. Are you there?
Hello. Hi, everyone.
Hello. Thank you so much for joining us and sharing a little bit about your story with us today. So we've got 10 minutes. I just want to ask you a few questions, really, if you can answer them, and we'll get to know you a little bit more about your journey. So how did your gambling addiction actually start then, Christine?
So I actually started gambling when I was a teenager, playing cards with kind of people's parents, actually. I think I found my first fruit machine when I was about 15. And then throughout my 20s, it was all casinos. It was what I would say it wasn't out of control. I definitely, when I did it, probably there was a difference between me and my friends, but I think because it was kind of like places like Las Vegas and stuff like that, it was more special occasions. And so, you know, maybe a few times a year I would go and I would heavily gamble, but, you know, it was sort of managed, I guess. And then in my 30s, I went to some bingo halls, found online. And yes, so from my early 30s, I had sort of a 7-year period where it was just a roller coaster and got very bad. And yes, this is my second recovery.
Okay.
So, I've now been in recovery, what I call proper recovery, for the last 3.5 years.
Congratulations.
I work closely with Lisa, with New Beginnings, and actually Bet No More were part of my recovery. So I actually seeked help through them, and Lisa was my peer supporter 3 years ago.
Amazing. That's amazing. So, you know, Christine, just from your perspective, obviously you had an interest in gambling from quite a young age. What was the draw to it? What was the buzz that you actually got from gambling?
It's a hard one to, I mean, when I look back at it, I think the first time I noticed was I went to Vegas for my 21st birthday.
Right.
And the first casino I walked in there, I was, I mean, it was one of the moments in my life where I remember it as being overly whelmed by excitement.
Right.
And so I just think I was always drawn to anything that sort of was escapism. You know, it was just appealed to me, I think, from very early age.
Yeah. And what do you think it was that triggered it from being manageable to that 7-year roller coaster?
It's the online.
Right.
Like you guys were talking about, the accessibility. I think because when I was doing it in land-based environments, because I started off in places like Vegas, I wasn't really interested in going to bookies and things like that. So I definitely knew that if I'd had access to it, there was a way that it could become a problem.
Right.
And definitely for me, I mean, the online, I had access to, you know, credit and money and things like that. So it was, yeah, the perfect storm, I guess.
It was definitely a big trigger, isn't it? Absolutely. So, how did it impact you at work? Because you were working at the time. So, you know, what did that look like for you, that part of your journey?
I mean, definitely at the beginning stages, and actually when it had got quite bad, you know, the saying that it's kind of, you know, the hidden addiction is definitely true. You know, even when I'd got into some serious trouble, no one noticed that there was something wrong. But that story from what happened by the end of it is very different. By the end, it was very noticeable at work. I would say as an employee, I mean, my performance was, I mean, it's like I'm a different employee now. I had to actually take time off of work because my mental health got so bad. And yeah, I told my employee what was going on eventually, and received great support. But I have to say, I wish I'd said something earlier, or maybe that someone had asked earlier, I guess. I think people kind of afraid to, they could see something was wrong, but I mean, how do you approach that situation? Or they wouldn't have necessarily known that it was gambling either.
Yeah. So there were obviously signs that people were maybe overlooking or feeling a little bit too frightened to even ask you. How long ago was that, Christine? Do you remember what year that was?
So it was 3.5 years ago. I've been in recovery
3.5 years.
2021. So mine
Right.
very much kicked off in COVID.
Right.
So yeah, the kind of in between lockdowns and then being back in the workplace. They definitely would have noticed a dramatic difference in even just, I mean, I'd lost a lot of weight from not eating.
Yeah.
I think the stress of what was going on as well. I was going into work without sleep a lot of the time and things like that. So there were a lot of signs by the end of it.
Okay. And it also sounds like a lot of signs that could have been contributed to poor mental health. And, you know, in this world now, 2024, we've been talking about raising awareness around mental health for the past 10 years. And there would be classic signs to be looking out for and be able to, you know, show concern towards somebody. So yeah, it's a shame, isn't it, really, that all this work that we've done on raising awareness, that people still don't feel comfortable potentially, you know, sitting down and saying, Christine, are you okay? You're looking a little bit tired and stressed and you've lost a lot of weight. Is everything okay? So that's a bit of a shame. But once you did disclose to your employer, you said that you got some great help. What did that look like?
Yeah, I mean, anything from, I mean, it was very much what could they do to help? You know, they kind of put me in touch with their system of like counseling if I needed that, things like that. They also were really supportive. I started going to Gamblers Anonymous. So, you know, things about kind of making my schedule fit in with whatever I was doing in my recovery. And then also at a later date, when I started working for Bet No More, they were extremely positive about that, and sort of worked my schedule around accommodating that job as well.
Yeah, I mean that's you know, brilliant, and that's definitely some recovery friendly practices there, isn't there? Having access to the EAP. Did you find that helpful, Christine? Because obviously EAPs are usually talk and therapy person-centered counsellors rather than addiction recovery counsellors or coaches. Did you find the EAP helpful for your problem?
So I was given access to their services, but at the time, because I was having one-to-one sessions through Betnamore, and I was also going to Gamblers Anonymous.
Right.
So for me, I'd kind of found the avenue that I was going down.
Good.
But definitely it was nice to know that it was there if I needed it.
Yeah, I think this is such an important thing. We hear this all the time as well. We've got an EAP, but in terms of if you're struggling with an addiction, EAPs generally are not, they're not the right treatment service for people. But yeah, good to know that it was there if you needed it. And you know, giving you access to time off when you needed to attend your group, your GA groups, really good support. And what about your manager? Did you find that your manager would talk about, you know, your well-being and your recovery? Did you feel as if it was a psychologically safe place where you could have those conversations and they were interested?
Yeah, I mean, as soon as, I mean, when I took some time off of work before the last lockdown, and when I went back, I felt well. I mean, it's a scary thing telling everyone, I guess, but I also kind of felt like that was the best avenue to go down. And I mean, pretty much, I think everyone, I work with about 80 people, and they all know. And it's very openly. I've made it comfortable for people to openly talk about, I guess. And nicely, actually, I've had other people in my workplace be able to sort of confide in me because they kind of saw that as somebody being very open about a problem that they were going through.
Yeah, absolutely. And it's so essential, isn't it? And I think this is one of the things around recovery friendly workplaces is we need people like you and I and Lisa who've experienced an addiction and are in recovery, who are willing to publicly, or as publicly as we are able to share that, so that people realize that they're not the only one. You know, we mentioned before, addiction is extremely isolating. You know, and a lot of people don't understand what problems you're going through and the stresses and the mental health and the sleep and, you know, the impacts on your work and your relationships. So it sounds like by you leading the way and being very open and transparent, you created a place that was psychologically safe for people to come and speak to you and get help themselves. Absolutely amazing. Is there anything that you think your employer could have done better or could have offered you more in terms of your recovery?
I think the kind of, obviously once there was a problem that they were aware of, they were amazing. But I guess it is that kind of, as a society, being more comfortable to comment when things don't look right. And I think that's, you know, present in most things at the moment. It's changing, I think, slowly, but I think the ability to sort of, point things out and see if somebody needs help before maybe they're at sort of a worse point, I guess.
Yeah, it's recognizing those signs, isn't it? And seeing, like you said, a change from your normal. What did Christine look like before? And there were some very clear concerns of the way that you were presented and the way that you'd even looked physically. That should have really been an alert for a manager to say, you know, is everything okay? I'm worried about you. And it sometimes needs to just be something as simple as that, doesn't it? Rather than go into, is it gambling, is it drugs, is it mental health? You know, it's more just of, I'm concerned about you, is everything okay? And it's such a shame that such a simple 2-sentence conversation still isn't happening in terms of, you know, when people are struggling in the workplace as well. Yeah, thank you for sharing your story, Christine. You know, do you have any kind of final comments that you want to share with the audience today around you know, your insights or, you know, your experience?
Yeah, I mean, I think for me, and it was kind of touched on before, you know, with Lisa sort of saying, you know, years ago, there wasn't that much support. And, you know, especially the conversation around, you know, a lot of the time doctors don't know where to send people and things like that. I think now there's so much support out there. And I just think the more just even companies are aware of just what support is there that they can give to people. I think for myself, I kind of went on the hunt, but it would have been really handy if it had been accessible easier, I guess.
Yeah. And here we are in Recovery Month. Here's a whole month that we have for workplaces to be able to actually raise that awareness of what support's available as well. So, you know, I know Recovery Month is not something that many workplaces know about. So hopefully the people who are here today will remember Recovery Month in the future and have the rest of the month to actually promote what recovery support is available for people. Thank you so much, Christine, for coming along and bravely sharing your story. I know what it's like to do that, and it can be quite nerve-wracking. So thank you for sharing that. I'm sure a lot of people will take a lot away from that, and how we can move forward and think about, well, what can we do more in terms of supporting people who may be struggling at work. Thank you, Christine. So if there's any questions in the chat box, pop them in there. I've got a couple more slides and then we'll look at questions and answers. So, you know, obviously Christine's given us a little bit of insight about what a recovery-friendly workplace can actually look like. So let's cover about work recovery-friendly practices. You've seen that it's tied in there with mental health. Now we have a wellbeing strategy maturity assessment that's running at the moment. I will follow up with a link if anyone would like to take it. This is perfect for HR and wellbeing leads who are looking to better understand any particular gaps in their wellbeing strategies. And what we've seen here, we asked 150 HR and wellbeing leads about what additional pillars, apart from mental health, were embedded into your strategy. So we can see the top pillars: 18% menopause-friendly workplaces. Financial well-being's up there with 14%. Physical health up there with 16%. Recovery-friendly workplaces and practices was down here at just 4%. But hopefully what you've learned today is that recovery, or people struggling with an addiction, it impacts their physical health, their mental health, their financial well-being, their social well-being. So in terms of your strategic well-being, it seems odd, now we know this, to not have recovery-friendly practices embedded into our strategic well-being, procedures, policies, support that's available. And as we heard there from Christine, it doesn't need to be a lot. So what are the benefits of doing this? The benefits is that it improves employee health and well-being, because by supporting employees through recovery, this can lead to better mental and physical health outcomes. Our employees will be more trusting and be more loyal to us because we've provided that support for them as well. It can enhance productivity. Obviously, people who are struggling or living with an addiction, it's going to impact their productivity, their engagement levels at work. So when we provide people with adequate support to remain at work as part of their recovery, they're more likely to be engaged and productive once they are in recovery. It can reduce turnover as well. You know, one of the things that I always say is that addiction doesn't stop at the C-suite door. So this may not be your frontline workers. This may be your managing director, your CEO, your finance director. And, you know, if you think about it in terms of support, you know, would we treat our frontline staff the way we would if it was our CEO who was struggling with an addiction? It's essential that we, you know, abide by equality and provide the right support for everybody in terms of what we would class a health problem, and see addiction as a health problem. So if we provide support and help people into recovery, it reduces turnover, it increases engagement and that loyalty, and can attract top talent. And the final one, it helps us to foster a positive culture. By promoting a culture of acceptance and support, it can enhance overall workplace well-being and morale. In terms of, you know, mental health and addictions in the workplace, there are some industries and sectors who have bigger problems than others, like the construction industry, like hospitality, like the financial sector as well. So in terms of this, you know, are we looking at it as part of our well-being culture, especially if we're working in industries and sectors that we know have got a huge problem? So what do recovery-friendly workplace practices actually look like? all we need to do is think about what do we need to do in terms of mental health and follow the same thing. We've got to promote that stigma-free culture. Stigma and shame are the biggest barriers for people getting help that they need. And we've got to be able to create that psychologically safe culture where people can feel as if they can stay when they're struggling and know that they're going to be supported. And one of the things that I always talk about is, making sure we treat people with dignity and respect. I've heard some really horrendous stories where people have tested positive for a substance in a workplace and it's not kept confidential. This is people's health information, so we should be treating them with dignity and respect and confidentiality as well. So that should be part of implementing your supportive policies. Think about, what does your policy say in terms of how we support colleagues who are struggling with an addiction? And how do we make sure that we are treating people with dignity and respect within those policies? As Christine shared there, manager knowledge is still a big gap. And we know that in terms of workplace mental health, only 48% of wellbeing strategies have mental health training for managers mandatory as part of their wellbeing practices. Now, as we know, our managers are the people that we build the relationships up with. We know them the best. They're a key area for preventing work-related stress and supporting our colleagues when they're struggling. So it makes absolute sense to make sure that managers have the knowledge, the skills, the tools, and the confidence to actually recognize that somebody may be struggling and offer that support through having a confident conversation around that. And provide access to education resources and signposting. So that's for everyone. As Rachel and Christine have both said, there's so much support out there, but often people don't know about it. So how do we ensure that we're using things like Recovery Month in September? We've got Addictions Awareness Week in October as well, back end of October. So there's another opportunity for you in the workplace to start looking at what education, what resources, and what signposting can we provide as part of our wellbeing strategy. And the last one there is to provide access to recovery treatment and support. Your EAP probably is not recovery treatment and support. So how do you look at what recovery support might be available for people outside of your EAP if somebody does disclose and is looking for recovery? We do this all the time. We talk about this all the time in terms of mental health. It's the same thing. We don't need to recreate anything. We just now need to consider recovery-friendly practices in our workplace strategies for improving mental health and well-being. So we're coming to the end of the session now. I have 3 minutes. I can't see any questions in the chat box. So what I will do is I will just go and share the support that's available. Here we go. So the New Beginnings from Bet No More program is specifically for women only. So you can find out more about that, and I'll send the links in a follow-up email at the betnomore.uk.org website, and just search for New Beginnings and you'll find it there. So it's for women only. And there's GamCare's National Gambling Helpline, which is already re-mentioned today as well. And they also have a website where people can talk through the website, through a chat, and get the support that they need. So, any final questions before we finish for the day? Thank you, Karen. No, thank you. I'm glad that you learned from our session today. It was really insightful. I really enjoyed talking to Rachel and Christine. I've also learned a lot today as well. So thank you for attending. If that's everything, thank you so much for joining us today. I just want to say a huge thank you to Katie for organising the session today with us, to Rachel for your training insights and your knowledge around this, and Lisa for all the work that you've done in terms of setting up the New Beginnings program and using your own lived experience to do that. It's just transformational. And thank you, Christine, for your bravery today and sharing your story. You know, I found a lot of relatabilities to it, being a woman in recovery myself. And yeah, I just know that this is such an important topic that we can do more to bring to workplaces, and it'll be people like you that will help us get that buy-in and show what it's like from a lived experience